Assalamu alaikum. In this video, we are going to explain some concepts and discuss clinical competence. We will attempt to do that by answering some questions. These are: what is the meaning of clinical governance? Why do we need it? What is required to have it in the hospital? Who manages clinical governance? What are the pillars on which the whole practice of clinical governance rests? And what is the role of doctors and nurses in this activity? So now to go on to the first question, what is the meaning of clinical governance? To put it in very simple words, clinical governance means a set of rules adopted by an organization to provide good quality of care for their patients and a safe environment for nurses, doctors, and all other people visiting or working within the organization. There are three essential components of this activity. The patient should have a very high standard of care. Secondly, suppose there is any unexpected event or incident involved with patient care or not involved, then it is the responsibility of the organization to investigate, analyze, and to learn from it. It is essential that it should not be hidden, denied, or pushed onto as a mistake made by the patient. The organization should learn and make changes that will benefit the patients in the short or in the long term. There should be a constant process to keep on improving within the organization. To summarize, firstly, every patient deserves a high standard of care. Secondly, the hospital has a responsibility to investigate untoward incidents. And thirdly, the hospital should learn and keep on improving the care they give to patients. We move on to the next question: why do we need clinical governance? There are three essential reasons why we need clinical governance. The first and most important reason is that we sincerely want to help our patients and help our employees. Health is now a business, and to succeed in any business, you want to have a good product and good outcomes. The second reason is that it is a legal requirement. A hospital must have a platform for ensuring clinical governance. An example of this is the United Kingdom, where it is legally imposed on hospitals and healthcare facilities. The third reason is, in some countries, there are third-party payers, for example, insurance companies and corporate clients. They will only allow patients to go and visit a hospital for treatment if that hospital has a robust clinical governance platform. So in summary, all stakeholders, which includes patients, their families, the hospitals, the third-party payers, the government, want the best for the patient. Within the hospital, the administration is responsible for maintaining a robust clinical governance program, and this is usually headed by the medical director. The next question we ask ourselves is, what is the requirement to have a clinical governance in a hospital? The essential requirement for clinical governance is to have an administration that is sincere about providing the best quality of care to patients, and who want to look after their employees and who want to be known as one of the best healthcare providers in that area. It is also essential that the employees have the agreement and the reassurance that the process to be followed in implementing clinical governance will not hurt the staff but make them stronger. The third requirement is to ensure transparency in all processes. If there is favoritism and nepotism, then clinical governance will never succeed. So we move on to the next question: who manages clinical governance? So the clinical governance is managed within the hospital by a number of different individuals and departments, with the medical director as the head. The hospital's senior administration must ensure that the structure of the health system will support the clinical governance structure and system. Policy and rules related to the implementation of clinical governance must be present, and there should be a formal structure to ensure that this will happen every time. The hospital must develop policies that will help stabilize care and ensure it can recognize problems quickly. The administration must also have managers who will support the concept and the practice of clinical governance. They should have skills in monitoring, planning, and conducting root cause analysis if a problem arises. The next requirement is information and data. The hospital is responsible for making sure the patient information is recorded accurately. These records are the property of the hospital, but they have to be kept in a secure place to ensure confidentiality. This is part of the transparency process. All the management should have access to the required information, and if there is any incident or event, the records will help analyze the root cause. Other resources which are required to maintain clinical governance is investment in the staff and equipment to monitor and to analyze data. Investment is also required in equipment to improve patient care. So we then move on to the next question, which is, what are the pillars on which the whole area of clinical governance rests, and what is the meaning of these pillars? So the first one is clinical effectiveness. This means that the patient has a right to the best possible treatment which is available. To achieve this, doctors must use current evidence as guidelines. The doctors should also develop contextually relevant policies. An example of this is that if you are working in a country where a large number of family members visit patients, then the hospital has to develop a very strict policy for visitation so that there is no overcrowding and no risk to the patient in terms of infection. Another pillar is that of risk management. This means minimizing the risk to the patient and everyone physically present in the hospital premises. Hospitals try to avoid accidents, and if they occur, do a root cause analysis so that such incidents or accidents can be avoided in the future. Hospitals try to learn about these incidents by identifying them in morbidity and mortality meetings, through near-miss identification, to document and identify patient complaints, and also incident reporting by a member of staff or a visitor. The next pillar is that of patient and public involvement. All the people who are working in the hospital are biased towards and thinking about the hospital. But if the business of the hospital is to serve the people and serve the communities, then the people in the community also need to be some part of this clinical governance platform, so that when policies are being made or when reporting is being done about the hospital risk management, then an input is taken from the members of the community. Other ways to get information from the patients or their relatives is to have satisfaction surveys or surveys in which the opinion of the common man is taken. Another pillar is that of audit. Departments have to be vigilant and they have to monitor the practices that we provide to patients through accurate record keeping. If the patient outcomes need to be improved, then these practices and services must be investigated by conducting regular audits. An audit is a process whereby the doctors agree that a specific treatment will have an acceptable outcome according to current guidelines. Once this decision has been made, the hospital data is collected retrospectively to identify if the results are as desired. If they are not, then we need to do an analysis of why this is not so. And subsequently, improvements must be paid to ensure good care. Once these new interventions are implemented, a re-audit has to be carried out to make sure that changes are being made and care is moving in a positive direction. Another important pillar of clinical governance is staff management. Staff hiring should be done according to the job's requirements and not based on favoritism or nepotism. Staff should have sufficient qualifications and experience. Subsequently, staff performance has to be monitored to ensure work is being done properly. A program should be made to provide staff development. Staff should not feel threatened and should be encouraged to participate in constantly improving the care of patients. Education and training is another important pillar on which clinical governance rests. The administration's responsibility is to encourage staff to continue their education and upgrade their skills. The administration can provide opportunities or create opportunities by organizing in-house classes, workshops, and seminars. Staff should be given paid leave to attend them either inside the hospital or outside. If enough resources are present, then even a course fee or a longer period of training can be provided. For example, a registered nurse who is recognized to have the capacity for management can be funded for bachelors in nursing. Data and information is a crucial pillar, and this patient information should constantly be updated and correct on any systems used. This information may be paper-based or may be online. The patient data should be kept confidential and only allowed access to hospital staff. Patients must also understand that hospital records are the patient's not the patient's property, but the hospital property. and they cannot be taken off premises. Physicians must have this data on hand to respond to complaints, to prepare morbidity and mortality meetings, and communicate information to other consultants outside the hospital or outside the department in cases of referral. Now that we have gone through the 7 pillars, let us move on to another question. What is the role of doctors and nurses in clinical governance? The role of healthcare professionals is to do audits, risk management, conduct workshops, lectures and seminars for upgrading knowledge and skills, and also to advise administration about new guidelines and for implementing new changes within the hospital in terms of education or in terms of equipment. Audit is a very important function of doctors and nurses, and whenever audit teams are formed, they will always be part of these teams. So after having gone through this question and discussing the 7 pillars of clinical governance, now let us just discuss risk management in a little bit more detail. To understand this better, let us take an example about how risk is analyzed when an event occurs. We have a case of a 24-year-old primigravida who is 39 weeks pregnant and is admitted to the labor room in active labor. Labor is progressing normally and the patient delivers a 3-kilogram baby as a spontaneous vaginal delivery. After the baby is born, the baby's heart is beating, but there is no effort for breathing and respiration. The baby is given oxygen through an ambu bag, and the pediatric team is given a rush call to attend to the baby. The baby needs intubation and is taken to intensive care. The family is very concerned and has made a complaint. As the hospital has a robust clinical governance program in place, the patient's and the family's concern is taken very seriously, and the medical director asks the obstetric department to investigate the case. The consultant doctor in charge of the labor room is put in charge of the team. The team will consist of all the people who are looking after the patient. These include the doctor, nurse, pediatric doctor, and the trainee doctor. The team will also have a manager of the obstetric department and a senior member of the hospital quality assurance office. The complete medical records of the patient are made available, including cardiotocogram showing fetal heart recording and the partogram. These will be analyzed and studied by the team. The team is responsible for doing a root cause analysis to identify why the problem happened. They will then recommend how it can be prevented in the future. The root cause analysis can be done by using the following methods. You can either do a practice of event and causal factor analysis, where only the causes are identified and presented to the authority. Or the team can conduct a root cause analysis by making a tree diagram or a fishbone method to identify what may have contributed to the event. The fishbone method is a very commonly used method for root cause analysis. The problem is identified and this is written down as the head of the fish. The problem here is an asphyxiated baby at birth. Behind the head, the bones of the fish are made to identify all the areas involved in the cause of the problem. For example, maybe the cause could be in the nursing, or it could be in the area of the physician care, or it could be that the fetal heart monitoring machine was either not present, or it was not used properly, or the machine was not working properly. The doctor may have given too many painkillers to the patient near the time of delivery, and this may have produced depression of the baby's respiration. The baby may have a birth defect, which was missed in the antenatal period. Was an anomaly scan performed at the right time by the right people? After analyzing each category, we can identify the cause of the problem. Maybe there was more than one cause. Was there enough staff to give attention to the patient? Was there any irregularity noted of the baby's heartbeat before delivery? Why was the baby's heartbeat irregularity not recognized in a timely way? Is there a need to invest in a CTG machine and have a backup biomedical team to rectify problems promptly? Is there a budget? Once the risk management team gives the report, the administration must make some changes. Until these changes take place, some arrangements are made to ensure the incident does not happen. With this, we conclude the description of the root cause analysis using fishbone method in the area of risk management. We now come to the end of the video, but before ending, please have a look at the description below the video title, and you will see a link provided for guidance about clinical governance in your area. If you like the video, please share, subscribe, like, comment, and press the bell icon to make sure you are notified when more videos are released. Thank you and goodbye.